So, how you doing?
I am fantastic. I am fantastic. I'm ready to talk about hormones.
Yes, hormones. Look, I really appreciate your time. It's been hard work to try and get in contact with you. You're a busy lady.
Yes. Yeah. And especially oddly now, everything has shut down and yet everything went online. And so the demands have gone up for online education and lecturing and speaking. And so I'm glad to connect. I'm glad that we can
Oh,
do this.
I'm so appreciative. So, Carrie, like you're an expert in hormones, and so you're a functional medicine hormone doctor. Is that correct?
Yeah, that's good. I like it.
Yeah.
Yes.
So you help to take control
Yes.
of people's hormones and, I don't know, improve their lives pretty much.
Yeah.
How long have you been doing it for? Like, give us a little brief intro to, you know, Carrie Jones.
So I have been in the functional medicine field for about 21 years, but I've been in practice, let's see here, since 2005, so 15 years. And currently in hormones, women's health, men's health, that's what I did. It's what I fell in love with. It's what I find really fascinating. I find pretty much everybody has hormonal issues or feels hormonal or gets accused of being hormonal. And now, right? And now I'm the medical director for a hormone lab known as Dutch, which stands for Dried Urine Test for Comprehensive Hormones. So I am surrounded by hormonal imbalance all the time that I work with. It's a lot of fun.
Wow. As you just mentioned that, what does it mean? Like when somebody says, "Oh, this woman is hormonal," what does it mean? What does it mean exactly? Yeah.
Well, right. Well, if it's true, if it's not somebody just, being mean, but if it's true, usually women will report that they're just feeling their mood is unstable. They feel moody. They're tired. They're having cycle problems. They'll say to you, I'm having PMS. I'm having heavy periods. My periods are irregular. It's women as they get older, they'll say, I'm having hot flashes, and then I get night sweats, and then I'm cold all the time, and I can't find balance. It's women who say, I can't sleep. I used to sleep. I can't sleep. Why can't I sleep anymore? Like, what is going on? And so because women's hormones literally go up and down through the month, it means our symptoms can go up and down with it. So we can have good days, and then we can have days where we're like, this isn't working for me. And it's very hormonally related. And there are a lot of hormones, but most women, when they say the word hormone, most women are talking about the hormones estrogen and the hormone progesterone. That's usually what they mean.
Can a woman pinpoint what hormones is a bit maybe sporadic or a bit imbalanced, and then be like, okay, this is what I need to do?
So, to a degree, testing is always best, so we know specifically what's going on, and especially because there are multiple hormones. Like let's take anxiety. A woman says, you know what, as I get close to my period, I get anxious. Why do I have anxiety? Okay, it could be because her estrogen's higher than it should be. It could be because her progesterone's lower than it should be. It could be that those imbalances in those hormones are causing brain hormones to be off kilter. So we have GABA, we have serotonin, we have dopamine. Those can all contribute to anxiety. It could be cortisol related. She has a lot of stress. Her cortisol is higher, her adrenaline's higher, she's not sleeping. That contributes to anxiety. And so it's really hard to say, oh, it's this one hormone, because it could be all of them. It could be, a domino effect where it was high stress and that kind of kicked off the cascade for all the hormones. Or maybe it was dietary. Maybe it was a medication she took and it affected her hormones. It could be a lot of things that cause the effect to happen.
So let's say she does the Dutch test and you have all these different imbalances. Like, what would be a typical procedure to start fixing things and putting things in place?
Super good question. So the Dutch test does not look at intestinal health or gut health. So we don't look to see if you have parasites or candida or why you have gas and bloating or constipation or stuff like that. But a lot of health starts in the gut. So when I'm talking to women about balance, I'm like, we start with the basics and we start with the gut. And so when women say, I feel stressed out and I feel moody and I can't sleep and my periods are terrible and I'm like, well, what are you doing for yourself? Are you going to bed at a decent hour? Are you staying up late on your phone? Are you eating healthy in the day? Are you drinking enough water? Are you moving your body? Are you exercising? And right now, with the pandemic and everything, a lot of women are like, no, my stress is high. I'm not exercising. I snack all the time. My job is in peril, so I'm stressed out. And so it's a big problem. It's a really big problem. And so I tell women, let's start with the basics and let's work on digestion, because how we absorb all of our nutrients that build our hormones in the first place and make our hormones and contribute to our hormones start in the gut. And so it's really nice to have the test to say to somebody, here's where all the imbalance is. But don't worry, we're going to take this in a very bite-sized, stepwise approach. And what we find is if we get the basics fixed and we work with the gut and then we work with the stress, that it all kind of shifts downstream. I don't have to go after every single hormone that's off balance for her. Usually I can just start at the top and then it all sort of trickles down, which is really nice. And then she feels better.
That's awesome. And it must work hand in hand with you being into functional medicine as well. You can just patch everything up. Well, not patch, but
yes, I just wave a magic wand. That's what I do. Yeah. If it was only that easy. Yeah, I have a lot more tools at my disposal. Functional medicine practitioners just have a lot more tools at our disposal versus like a lot of women get told like, oh, here, you have, here, take the birth control pill, or here, take this anxiety medication, take this antidepressant. And women are like, I don't want that. Like, that's not my problem. The problem isn't a birth control pill. The problem is whatever. The problem is I have really bad PMS and heavy periods. Like, that's not a birth control issue. That's a hormone issue. So can't we just fix the cause? Or women are like, I can't sleep. Like, I can't stay asleep. I don't think I need an antidepressant. Like, let's figure out why I can't sleep. And what's really nice is that, I have a lot of tools to go, okay, let's work on lifestyle stuff and let's work on sleep hygiene and let's work on, here's herbs and vitamins and nutrients that are supportive.
I had a question in my head. I forgot now. Because I was thinking of two questions at the same time. I was like, no, stick with one. I'm going to have to try and come back to that one, whatever that was. But so I'm also thinking about just moving over slightly to testosterone. I mean, it has so many different responsibilities. I'd definitely like to, understand a bit more about, what its role basically.
Well, in men and women, we both need it, right? Testosterone is what makes men, but women need it too. In men, testosterone is made in your sleep. So for, the guys listening, make sure you're getting really good quality sleep. That's what helps you make testosterone. But it comes at the direction of the brain. So the brain tells your testicles to make testosterone. Whereas in women, we don't make it in our sleep. We can, but it's not like men. And we make it in 3 different places. We make it in our ovaries, we make it in our adrenal glands, and we actually can make it in our fat tissue. And so with women, if they have problems with their ovaries, there are a lot of cycle issues. If they have problems with their adrenals, lots of stress, they can have problems with their testosterone as well. And so many things go into making testosterone, and so many things can suppress testosterone. Just like being zinc deficient, not having enough zinc, not eating enough zinc, not absorbing zinc can reduce testosterone. Being hypothyroid, having a sluggish or low thyroid can affect testosterone. And this is in men or women. It doesn't matter. And so it's really important when we're looking at testosterone. We need it as men and women. We need it for mood. We need it for lean muscle mass. We need it for part of our libido. We need it for, brain health. We need it for lots of stuff. It's not like, oh, your testosterone's low, take testosterone. It's like, well, let's figure out why is it low? Is it a communication issue? Is it a brain issue? I don't think a lot of people realize this, but our hormones are made in our mitochondria. So we all learn in school, our mitochondria are cellular powerhouses, right? It's where we make energy as humans. It's also where we make hormones. And so I'm telling people all the time, nutrients are really, really important for the mitochondria. The easy stuff, exercise, weightlifting is really helpful for the mitochondria. Avoiding chemicals. Chemicals kill the mitochondria. So let's read labels and see what's going on. Intermittent fasting. If you talk to your clients about intermittent fasting, it's really supportive for mitochondria. Cold showers. Ending your shower in cold. Doing the cold plunges. Swimming in a cold lake. Really good for the mitochondria. So it doesn't have to always be a supplement. There's definitely lifestyle stuff we can do to help support our hormone production, but testosterone is a big one.
Wow.
I know.
So, wow, there were so many questions again.
You need to write this down. I will say that too much of, it can be too much of a good thing. Women, right? Men too. We get too much testosterone. What happens? We get male pattern baldness. We get cystic acne, right? Women get polycystic ovary syndrome, PCOS. So testosterone can cause issues if it's too much. It's everything. All the hormones are like, Goldilocks, right? We want like not too little and not too much, kind of depends. We want it just right. Otherwise we can get symptoms. And same for men. Men, when your testosterone is going down, is too much, or it's going down a pathway that's too potent. We call it the 5-alpha pathway. Men get prostate issues. Men get male pattern baldness. Men get angry. Men get acne, right?
When it goes down or too high?
So when it goes down a certain pathway. So testosterone can change and go down different pathways. One of the pathways increases the risk for like prostate problems. So there's a test. It's called DHT, dihydrotestosterone. And so a lot of men's health experts, make sure to check men's DHT levels, because men don't want prostate issues. Men don't want male pattern baldness. Men don't want to be angry. So we're trying to help that.
DHT. And when does that need to be done, this test?
You can do it. So if you do Dutch test, it's there, or you can do it in a blood draw. So if you're a man and you're getting your testosterone checked, you can ask like, hey, while you check my testosterone, can you also check my DHT? I want to see what my DHT is, especially if he's symptomatic, if he's having problems.
Right. But otherwise you can have it done at any time. There's no specific time when. Okay.
No, that one's not timing.
Right. What about growth hormone?
Yeah.
How is that
growth
produced?
Hormone.
And what's its benefit? Okay, another one.
Yeah.
What, when you sleep?
So another one at night. Growth hormone's a big one for night and after exercise, especially things like weightlifting, HIIT training. You get an increase in growth hormone. I call growth hormone like you're scrubbing bubbles. It goes into all your cells, right, and it cleans them up and cleans them out, and it helps growth and going forward, expansion. That's what growth hormone does. So when you have less growth hormone, when you're young, you don't grow, which hence its name. But when you're older, it plays a role in like disease prevention. And we like our growth hormone to be at healthy levels, which is why as we get into adulthood, sleep should be a priority. Exercise needs to be a priority, because not only will it help our mitochondria, it'll help our growth hormone. So it's good stuff.
You get people who actually go to the doctor and get some, I don't know if you'd say synthetic, but they have it increased. What's your thoughts on that? Is that necessary?
Yeah. There's a couple ways you can do. So there's actual growth hormone, and then there are peptides. There's a new kind of part of functional medicine called peptide therapy, and it's giving you, it's an injection. It's the peptides to help to naturally increase growth hormone. So it's not giving growth hormone, it's giving kind of the precursors to help get your growth hormone up there. And so I'm not trained in peptide therapy, but my friends who are have said that they've seen really amazing results with people who had low growth hormone using the peptide therapy, and then improving their skin and their energy and their sleep and even their lean muscle mass by using the peptide therapy to support growth hormone. There are a lot of peptides out there. That just happens to be one of them.
Right.
So, yeah. So that's the one I know the most, as opposed to just giving, growth hormone.
Right. What about, you'd mentioned hormone replacement therapy?
Hormone replacement therapy. Yeah. So hormone replacement therapy is a really big topic, because think about it. Thyroid medication is hormone replacement therapy, but we don't think about that. And lots of people are on thyroid medication, right? But then we have estrogen, progesterone, testosterone, DHEA. Those are probably like your most common replacements that people talk about. And so, and for men and women, you know, men will go in and get testosterone replacement. They'll get a lot of tea and, you know, pellets or creams or injections. And then women will get capsules, or they'll get creams, or they'll get pellets, or, you know, they get the same thing. So in as long, I'm a big fan of the bioidentical. So the hormone replacement therapy that looks like your own, as opposed to synthetic. I'm a much bigger proponent for bioidentical. And I'm a big proponent that, you know, like if you need it, and depending on your history and making sure you've gotten all the appropriate workup, that it could be life-changing for men and women, you know. Women, especially as they get closer to menopause, they will talk about like, "Ooh, I don't know, estrogen causes cancer. I don't know if I should do hormone replacement therapy." But yet we know estrogen is also really protective against like our bone health and brain health and our heart health, cardiovascular health. It's good for the skin and collagen. And so it's a double-edged sword, because obviously I don't want cancer, but on the flip side, cancer is not the number one killer of women. It's heart disease, it's cardiovascular disease. And so I'm actually talking to a lot of my perimenopausal women now, like, you know what, like, you have all the symptoms. You're dry, you have hot flashes, you have night sweats, you're starting to forget things, your joints are hurting, like you're losing estrogen. So I think we need to do a little bit of estrogen and help support yourself. So for the right person, it can be life-changing. It can really help improve a lot of the symptoms and reduce risk of other serious conditions if they're on hormones.
What would be a symptom in men when they need some sort of hormone replacement therapy?
So the big one's testosterone. So testosterone in men, we tend to think as testosterone goes down, men tend to say, I'm more tired. I'm not as motivated. I don't feel as much on my A game. I don't really care. I'm not going after it anymore. They'll notice they slow down in their sports, their exercise, their weights, weightlifting. They'll notice sexual, issues. So erectile dysfunction, libido starts to decline. They start to get the belly, and they'll start to get the breast development. The pecs will turn into more fatty as opposed to muscular. And so as testosterone goes down, that we'll start to notice that, because then what happens on the flip side is estrogen goes up in men. And then estrogen in men, estrogen can cause the weight gain, the breast development, the moodiness. So they're less motivated, maybe more depressed. And so that's when men start to go, maybe it's my testosterone. Maybe I should look at testosterone. But keep in mind, lots of things get in the way of testosterone. So I have men in their 20s who say, I have low testosterone. Should I go on testosterone? I'm like, no, you shouldn't go on your testosterone. You're in your 20s. You have to figure out why it's low. What happened that in your 20s you have low testosterone? And especially because once you go on testosterone replacement therapy, it does stop your own testosterone production, right? So be careful. So to a degree, once you're on it. And it will also stop sperm production. So the young men who go on it and they haven't yet had families, and then they'll meet the love of their life, they'll decide to have children. And unfortunately, because they're on testosterone replacement, it can really, really, really reduce sperm production. And now fertility is a problem.
Wow.
So we have to be very careful with men. We can't just give men testosterone like candy, especially younger men.
That is very interesting. That is interesting.
Yeah. And it's not talked about much, because men, they don't want their belly, and they don't like their breast development, and they want back on their A game. And so they go to their doctor, and their doctor's like, yeah, testosterone, let's do it.
So what's happening with guys who, what is the body trying to do when guys start to develop breasts and they feel lazy? Like, what is the body? Is the body just getting ready for shutdown? Like, what's?
I hope not. Right? I think most men are like, no, not shutdown.
Yeah.
So I actually honestly think a lot of it is external influences. whether they made the choice or not, I think there's a really good research paper that talks about the decline of testosterone in men over the years. And a lot of it is around environmental. A lot of it is around environmental exposure of like plastics and solvents and fertilizers and chemicals and the crap in our food, and how that's taken its toll on the way men make testosterone, on their ability to make testosterone in a healthy manner. And so his choices play into what his testosterone is doing. And so I think his body is it doesn't have a choice. It's being forced. It's being sort of forced to shut down. It's not, that's not choosing to, it doesn't want to. I think in that case, a lot of it's forced. And nowadays, you know, just with the lack of exercise, the lack of movement, the increase in junk food and unhealthy food, and the food that just doesn't have a lot of nutrients to it, you know, fast food and chips and candy and beer, and like none of that's nutrient dense. And so it gets in the way of producing testosterone in men, and it increases their estrogen production, on top of the fact that we're surrounded by plastics. There's chemicals and everything. You know, he's using body wash and shampoo and cologne, and he's got the thing hanging in his car because his car smells, and he uses, you know, the room spray because it smells, and like he just gets all that in him, and unfortunately it can affect testosterone, and it can increase estrogen.
Wow.
I know.
That's
so I'm
insane.
really cognizant with men. I'm like, hey, look, I need you to be as diligent as women. I need you to read labels, and I need you to, you know, stop drinking out of plastic. I need you to stop microwaving in plastic.
Oh God, microwave.
Yeah.
I used to do that. And,
we all did.
God, microwaving in plastic is insane.
Yeah.
Oh, and GMO chicken as well. Like,
Yes.
Wow. So obviously men need estrogen as well. Like what role does it play for a man to have estrogen?
So it is also helpful for brain health. It's helpful for bone health. Too low of estrogen can increase a man's risk of bone loss. So we talk about osteoporosis and osteopenia in women. Men can have it as well. And estrogen does play a role in brain health in men, in mood. Testosterone gets all the love in men for sure, but estrogen plays a role. So we don't want it zero. I mean, again, men often will think, I'm going to get it as low as possible. I want it near zero. I'm like, you really don't. Everything's in balance.
How do you balance that? I mean, you know, you can try and have a healthy diet, good sleep, and everything for testosterone. With the estrogen, however you want to pronounce it. How do you know if you're doing okay or if it's too low? Like
testing. So with men, I'm like, go get a blood test.
Only testing.
Only testing. So you can test your total testosterone. You can test your free testosterone, and you can the estrogen you test is called E2 or estradiol.
Right.
I guess you'd pronounce it estradiol. And so, so you can blood test it. So men can definitely check their own, you know, they can work with their practitioner. It's not it doesn't need a fancy test. You can just get a blood draw.
Cool.
And follow his levels. Same with DHEA. A lot of men like to know their DHEA level, another androgen, and it's primarily made out of the adrenal glands. It's big for stress response, but big for energy, good for mood, good for brain health. And so you can do a blood test and check that as well.
Awesome.
Yeah.
Awesome.
Just keep in mind, women and men, there's right now in the world, unfortunately though, there's age ranges and then there's optimal range. And so if you get a test and it says, oh, you're 35 years old, you're totally in range, but yet you have all the symptoms of it being low, that's not your range. Maybe you need to be in a better range, a more optimal range for you. And in testosterone in particular, they have had to drop the age range, the age ranges over the years because men's testosterone's dropping. So labs are meeting men where they're at as opposed to holding them to where they were. Right.
Got you. Yeah. So it's, again, because of like cologne sprays and perhaps the food that we're eating, loads of microplastics, even in the salt, and just, everything.
Yeah.
Insane.
Yeah, absolutely. And then think detox, right? Estrogen has to get cleared out of the body. Well, everything does, but since we're talking hormones, Now you drink alcohol, men or women, doesn't matter. You drink alcohol, have a couple glasses, and that affects the way you clear estrogen out of your body. And alcohol will win. Alcohol will get through the liver first, and it essentially, to make an analogy, pushes estrogen back out into circulation. It's like, no, I'm here first. You go recirculate. So now you have all this extra estrogen, and that's why men, we call it the beer belly, right? As they drink more alcohol, they tend to get that belly in the front that kind of hangs over their belt. Yeah. And part of it is insulin and glucose. Part of it can also be estrogen as well. Estrogen in men is made primarily in your fat tissue. And when the liver can't clear it in a healthy manner, alcohol being a big trigger, then it increases adipose.
That is so interesting.
I know.
It makes sense.
And it's the same for women. Women are like, those 2 glasses of wine a night, is that affecting my fat tissue? I'm like, it sure is. It sure is. It's affecting your hormones. It's affecting your sleep. It's affecting how you detox. It's affecting your skin. It's affecting everything.
I hear so many different things about alcohol. Some people say, oh, you should have at least a unit a day or 2 units a day or a few a week. Is there a safe amount, or is it best to just keep away from it?
Honestly, it depends on the person. And I don't mean that lightly. So 100% alcohol affects detoxification. So if you are struggling with hormone issues, if you are struggling with weight and fatigue and sleep and skin, then alcohol is probably not going to make you any better. It's only going to clog up the system. It's going to make you feel groggy. It's, like you still have to process it. It's still alcohol at the end of the day. Yeah. Some people are like, well, I like red wine. I like organic, small batch, biodynamic red wine because of the resveratrol. I'm like, well, then take resveratrol. Like your liver still has to work. And I drink. I mean, I'm not saying this as somebody who doesn't drink. I definitely have the occasional glass of wine, but I also know what I'm doing. I know that when I drink alcohol, I'm depleting my glutathione, which is a big antioxidant. I know it's affecting my estrogen. I know it's increasing my estrogen because I know too much. I know what it's doing to my body. Yeah. But on a nice night and a nice dinner or a celebration when we were allowed to celebrate stuff, I like a glass of wine. But the people who try to justify their everyday habit and they have hormonal problems, I'm like, I think your habit's part of the problem. But if they're not having hormonal issues and they're really, really balanced and they're like, I just have the occasional glass, I'm like, great, you do you. That's fine. It's the unbalanced people who are seeing you as clients and they're like, nothing's working. And you're like, well, 2 glasses of wine a night will do it. I'm sorry to tell you. Yeah. And I get justification all the time. I'll get, oh, Carrie, but it's tequila. Tequila doesn't affect my blood sugar. I'm like, still alcohol, still affecting your estrogen, still affecting the way your liver detoxes. It's the same with the small batch biodynamic. Big fan of it, still alcohol. Like you still just, if you're symptomatic, if you're having hormone imbalance and you're drinking regular alcohol, cut it out for a month and let's see if you notice a difference.
Right. Cool. Well, yeah. I don't need to be concerned about that. I don't drink at all.
You're good.
What about, can women hack, what they call it? The PMS? Is it hackable?
Yes. Is it hackable? Yes, it is definitely hackable. It's hackable. So PMS, most of the time, but not always, most of the time, it is an imbalance between estrogen and progesterone. And so as we lead up to PMS time, that's the time where I'm telling women, you got to take care of yourself. Like this is the time where you need to set boundaries. This is the time where you need good sleep. This is the time where you may need to shift how you train, how you exercise. Making sure you're getting a lot of fiber, making sure you're getting a lot of omega-3 fatty acids, making sure you're, getting a lot of your vegetables, getting your nutrients, magnesium, so helpful for PMS, vitamin B6 or a B complex, so helpful for PMS. There's a really great herb. It's called chaste tree, otherwise known as Vitex, can be really helpful for women with PMS. Evening primrose oil, which is another oil, can be really helpful as you get close to that PMS time. And so there's good oils, there's good fiber, there's good stuff. Probiotics, gut health and PMS are very closely tied. So I'm telling people, if you can, eat fermented foods, take a probiotic, let's improve your gut health. It'll help your hormones in the end.
Does it matter? There's so many different types of probiotics. Are they all the same type of bacteria, or are they different types?
No, so they're all different types. They're all different types. So there's like very broad spectrum. You'll see like we have 20 billion strains in one capsule, and then others are very specific. They're like, we have two strains, just two. And they can do different things. And then other probiotics are what are called spore based. So that it kind of sounds scary, but when you take them, they help repopulate and improve just gut health in a different manner. That's what I take. I take the spore based probiotic only because, well, I really like it. Actually, I have access to it, and then I actually think it really works. But like certain strains, when you work with a practitioner who's really sort of dialing this in, like certain strains will help yeast infections, and certain strains will help maybe endometriosis, and certain strains will help. So we can kind of get specific depending on, what's going on with you. And then there's just broad spectrum probiotics. That broad spectrum will help most of the people, a lot of the people. So if you don't know what to take, I'm like, well, just pick a good quality broad spectrum until you talk to your practitioner.
Right. I've been told that it's good to have, a broad spectrum of them anyway, to have an ecosystem with loads of different bacterias. It's always good.
You can test that too. I mean, there are, I call it, you can poop in a cup for science. There are stool tests, and they will tell you what your diversity is. They will tell you like, ooh, you don't have a lot of this, but you have a whole lot of that. And so you can, you and your practitioner can work to help rediversify your gut bacteria. Or maybe you have yeast or candida. Maybe you have a worm. Maybe you have parasites that have grown up. And so you need to eradicate that and then support the microbiome that you have. So
I've done a test actually. So that was fun. It was
it's fun.
I don't know how to explain it. I had to place this thing over my toilet seat, and I had to, defecate on this material, and
and dig through it, and then scoop it.
Scoop it up, and then put it in a little tube and seal it, and wash my hands thoroughly, and that was interesting. So it took about 6 weeks or so to come back with the results, and it was really interesting how they're able to tell me certain combination of foods was not working, and that I would have to maybe take one thing out and then something else can work. I can't remember everything off the top of my head, but I do have the report if I was to go back through it. And I just found it quite fascinating, how the different bacteria are working in our body. And then I started to learn that we've got more bacteria DNA than actual human DNA. And I was like, what? This is even more crazy. Like,
there's a meme that I've seen that says, we are, as humans, we are what our gut bacteria do with us.
Yeah.
So we have to take care of them, but they are in turn taking care of us, or trying to. Yeah,
trying. We just got to help them out. Right?
And they'll shift in about 24 hours. So if you are a very healthy eater, and then let's say you have a massive cheat day, in about 24 hours, your gut microbiome will shift because of your cheat day. All the whatever you ate, pizza, alcohol, and soda and chips, whatever you chose, but 24 hours. So then if you get back onto your normal eating, it'll shift back in about 24 hours. And so so people will say like, oh my gosh, this is going to take forever, Carrie. I don't know if I can do this. I'm like, no, it's your microbiome. Do not mess around. They move fast, and you can make big changes in small periods of time. Now it's harder if you have an infection. So if you were to tell me like, well, I had worms, like food will not get rid of worms. You have to kill them.
Yeah.
But microbiome, your gut microbiome, your own bacteria that live in your body that are, good for you. Like you can shift them and adjust them.
Worms themselves, does that affect hormones in any way?
They can. Yeah. So any kind of infection or inflammation definitely affects how we make hormones. Yeah.
Right.
And people will tell you too, people will say, they usually don't maybe know they have worms, but if they're like, gosh, I have so much gas and bloating, and they'll start to tell you about the hormonal symptoms as well. I have so much gas and bloating, and I have endometriosis, and I have severe, cramps with my period. I get PMS. Oh, and I have brain fog. I can't think. I'm so tired all the time. And I have joint pain. Like there's a lot of and when we talk about gut health.
Right. Right.
And that's
What about,
men or women. Men get it too.
okay. Yeah. 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 What about I think it's called PCOS?
Mm-hmm. Mm-hmm.
Polycystic
Polycystic ovary syndrome.
Yeah.
Mm-hmm. Yeah.
What is it?
So there's a few, I'll tell you the classic. So there's a few forms of it. So it's the typical diagnostic criteria. There's 3 things. You only have to meet 2 of them to get diagnosed. One of them is you actually have cysts on your ovary. So as a woman, you will go get an ultrasound and they will say to you, oh my gosh, you have so many cysts, it looks like PCOS. So that's one criteria. Another criteria is that you have what we like crazy cycles. So you don't ovulate, your cycles are irregular. Sometimes you get them, sometimes you don't. You don't release an egg. Maybe you are struggling to get pregnant. So that's another criteria. The third criteria is that you have high levels of testosterone or DHEA and the symptoms to go with it. So these women say, I'm getting hair growth in places I don't want. I have acne on my jawline and on my neck. I'm losing hair, the male pattern baldness, what's happening? So you only have to have 2 out of those 3. You don't, despite the name, polycystic, you don't have to have the cysts. The most common reason, although there's other reasons, the most common reason for PCOS is it's very insulin related. It's very, there's a lot that goes into it. There's some genetic reasons that women genetically will make more testosterone than other women. They will struggle with insulin more than other women. And all of it goes to affecting how they make their hormones, that they don't ovulate. They tend to gain weight around the middle. They often struggle with fertility. And so that's sort of a common form of PCOS. Now, there are other forms. Inflammation can induce it. High stress, it can be more adrenal related. You can get very similar symptoms. Women who have come off the birth control pill, so they were on the birth control pill for years, and they come on and they kind of, what we call it's post-birth control PCOS. And so what we used to think of PCOS is now expanded. It's now actually really much broader, which is great because now we can like really pinpoint where a woman is and really help her. But it's really common and it gets blown off by a lot of practitioners.
Wow.
Yeah.
So with the birth control, is it good or is it bad or does it depend?
So yeah, that's a really hard question. I am not against birth control at all. I'm very, if a woman is like, I don't want to be pregnant, this is what I need, like, thank God we have it. Absolutely. What I am against is that so many women are not told of the risks. And then when they get the risks, when it happens to them, nobody thinks to say, it might be a birth control pill. Like maybe we should stop that. Instead, they're like, oh, you're depressed and suicidal now. Here's a antidepressant on top of your pill. Like, oh, you have a lot of GI issues, gas and bloating and whatnot. You must have IBS. Here's a pill for that. Like, oh, you're having, these other, it's really unfortunate that these women are not commonly told about the long-term risks and the side effects that can happen. And then if they get the side effects, I'm like, you should tell me, we need to stop the pill and find something else. So I know there are doctors that are against it, and I'm glad we have birth control options. I just wish they weren't so chock full of risks and side effects. That's my only.
Would that be all of them? Are there any birth control pills which are?
No, no, they all come with a lot of risk. Birth control pills, yeah. So the pill, the birth control patch, the ring, the injection, the implants, They all have a lot of risks when you read up about them that women need to know about. There's the coils, the IUD. There's one that's hormonal, and it has a synthetic progesterone in it. And then there's another one that has copper in it, that it doesn't have any hormones in it. They both also have side effects. They just act differently. And so with women, I'm like, look, here are all your options. Here are all the things, here are all the risks, potential side effects, and here's what you need to look out for. So if you get any of these symptoms, you need to let me know immediately, because I don't want to blow this off. There's a really great book. There's an author, her name is, or she's a doctor, Dr. Jolene Brighton, and she has a book called Beyond the Pill, and she takes women through all the just really easy to understand information about birth control, all forms of birth control. Even though it's called Beyond the Pill, she talks about the IUD as well and other stuff. So she's a wealth of knowledge, and she actually has coined the term post birth control syndrome because of the women who are come off the pill and are like never well since. Like, I was never well since I went off the pill. I have all these problems. Wow. She's the one who figured it out and then wrote the book about it. So, no, but lots of women are on the pill or have the IUD and do great. I mean, a lot of women write me and they're like, I've been on the pill and I have no issues. I'm like, fantastic. I'm not talking to you. Like, you're not who I'm addressing. Like, it's all the other women who are, really struggling. They're who I'm addressing right now.
Are there pills for men?
No.
Okay.
There's a vasectomy. You can get snipped. It's about all men have right now. Yeah. Barrier method, right? Barrier method, vasectomy for men, abstinence. Which is no fun. So yeah. It's terrible. It's terrible. When I joke all the time, when I am in charge of the universe for women, when I'm in charge of the universe for women, it's going to be a button or a switch that they can just be like, I don't want to be pregnant this month. And we just push this, and then it's done. It's easy. There's no side effects. And then when she's ready to be pregnant, she's like, let me just turn that on. Make it so much easier.
Yes. Oh man. So do you do things, do you understand a lot about like things like ghrelin, the hunger hormones, and cortisol and all other types as well? Yeah.
The leptin.
All right, let's talk about cortisol. What I understand about it is everyone says, when your cortisol raises, you don't want it to raise too much, and we know that it raises up in the morning. What other benefits does it have besides helping you wake up?
So many. Ooh. So cortisol is known, technically, it's called a glucocorticosteroid. Gluco, because glucose, your blood sugar, is the primary thing it manages. If you can't get your blood sugar right, you will never get your cortisol right. And if you can't get your cortisol right, you will never get your blood sugar right. That's what it manages. When cortisol goes up, it tells the body to release glucose into circulation. So it deals with blood sugar management. It helps us switch from conscious to alert in the morning. So you wake up, your alarm goes off, you're like, okay, I'm awake. And it should take roughly 20 to 30 minutes for us to switch into an alert state. Most people can't. Most people need about an hour and some caffeine, and then they feel alert. But cortisol is what helps us get there. That rise in cortisol in the morning has a lot to do with autoimmune disease. What it does is when your immune system is very intelligent, and your immune system makes an immune cell, one of your little soldiers, but it runs it through like a screening process to make sure that your soldier is not reactive against you, which is called autoimmunity. So your body wants to make sure, like, did we accidentally make this cell autoimmune? And if it accidentally made it autoimmune, it pulls it to the side, and the spike in cortisol is what triggers the killing of that cell. Because we don't want a cell floating around that's autoimmune, in theory. So if we don't have the spike in cortisol, then those little autoimmune cells, in my head, in my analogy, they like slip out, they sneak out, and they go out into circulation, and they can worsen somebody who has autoimmune, or they can increase somebody's risk for developing autoimmune. So cortisol has a lot to do with our immune system. So blood sugar, immune system, alertness, mood, Our resiliency, how resilient we feel. Cortisol has a lot to do with that.
How resilient we feel.
How resilient we feel. Like, do you feel burned out? Do you feel like you can take on the day? Do you feel like you can handle stress? Or do you constantly feel like your plate is too full? Cortisol partly helps you manage that. And so it's really important. Now, too high of cortisol all the time, yeah, absolutely, that can be a problem. That can be a problem.
Is that when stress levels are too high? Or is it that causes high stress levels? Which way is it?
Stress comes first and cortisol responds. Now, stress comes in all forms. Stress can be physical stress, emotional stress, mental stress, but it can be inflammation. So let's pretend you shouldn't eat dairy, but you don't care. You eat cheese every day. Every time you have cheese, your body, your immune system has to react against it if you're not supposed to eat it. Every time your immune system reacts, your cortisol has to react, which means every time you eat cheese, even though you know you're not supposed to, you set off an inflammatory cascade. Your immune system goes off, inflammation happens, cortisol goes up every time. So I tell people, it could be stress that you can't control, but it can also be stress that you can control and you're choosing to do otherwise. So yeah, a lot goes into cortisol. Yeah. And we want cortisol to be able to, spike. We want, if like you were telling me the story earlier about your bike, right? Where you're like, come on, I have an appointment. You have to fix this faster. Your adrenaline starts to rise, your cortisol starts to rise because your body's sensing like you're getting frustrated. So you want that. That's a healthy, normal human reaction. Like, are we going to fight? Are we going to fight? Well, let's do it. And then, you're like, oh, I got my bike back. Cool. And so then it comes down. Yeah. But in a dysfunctional person, they spike up high all the time, or they have this kind of chronic high level. And that's where we get into problems.
So if it stays high at all times, what happens to the body then?
So it increases your risk for like weight gain. It increases your risk for diabetes and pre-diabetes. It increases your risk for high blood pressure, cardiovascular disease. It increases your risk for lots of stuff. So you got to be really careful. Stress management is a really important part of hormonal balance.
Okay. Let's talk about thyroid. What's the main purpose of thyroid, and what causes hypo? Is it hypo and hyper? Hypo and hyperthyroidism. Yeah.
Yeah. So the thyroid sits right here. It's the little gland that's right here on your neck. And it does so much. It plays a huge role in hormones. So it helps a lot with energy and metabolism, and it helps with fertility. For women, it helps us with, do we ovulate? Do we not ovulate? It helps with, muscle building. It helps with brain health. It helps with skin. I mean, digestion. Thyroid has a lot to do with how we move our digestion through our body and out. So hypothyroidism is when things slow down. So now we are more prone to constipation. We are more prone to weight gain. We're more prone to hair loss. We're more prone to dry skin. We're more prone to fatigue. We're more prone to like mental slowness. Hyperthyroidism is the opposite. It's when your thyroid has a lot of hormone out in circulation. Hyperthyroid, you tend to feel sweaty and anxious, and your blood pressure is high. You tend to lose weight, not always, but you tend to. Things are moving much faster. You're more prone to maybe diarrhea or looser stools. And so again, with thyroid, it's much like other hormones. You want it in balance. It's like Goldilocks. Not too much, not too little. But yeah, thyroid's a big one. And we think of thyroid as mostly a woman's condition. And I'm hearing more and more men diagnosed with hypothyroidism. And I want men to know that, because I don't want them to get forgotten or blown off by their practitioner. Like, oh, that's what women get. Men don't get that. It's not true. Men can get hypothyroidism, and hypothyroidism will affect testosterone and fertility. So we have to be careful.
What is the best type of foods to keep your thyroid in check?
So that's a hard one. There's a lot of really good nutrients that are good for thyroid. With thyroid, it's not like it's it's not like eat carrots and your thyroid will balance. Like it doesn't work that way. But there's a lot that goes into making thyroid. Like for example, tyrosine, iodine, selenium, zinc, copper, these things, all iron, all go into the multi-pathway to make, to get from point A to point Z. Like there's a lot of nutrients that go into that. So whatever diet you're eating that's giving you all those nutrients will only help your thyroid. If you're not eating a very diverse diet, if you're eating a lot of empty calories, then that's not going to help your thyroid. You're going to struggle to make it.
Cool.
Yeah.
Interesting. I used to just, you know what? I didn't really know much about thyroid. All I know is if it's not functioning well, you'll end up putting on some weight. That's what I understood. Like if it was a hypo.
Mm-hmm.
Yeah, hypo. So I thought, well, I'm not fat, so I'm sure it's active or okay. But yeah, I didn't know, all the other things it was linked to. That's really interesting.
Yeah, a lot. And especially for women, especially as women go through changes. So getting pregnant, delivering the baby, perimenopause and menopause, those big shifts in our life increase our risk for thyroid problems. So I tell women, hey, look, make sure when you get pregnant, you get your thyroid checked. Make sure when you deliver the baby, if you get your thyroid checked again. Make sure if you get close to perimenopause, get your thyroid checked again, which some women are like, man, that's a lot. I'm like, I know, but it's these big shifts in our hormones in our life that can affect how our thyroid works. So don't miss it. Don't miss it. Because there's so much we can do. So be proactive. Yeah.
Cool. What about oxytocin? Is it known as like the love chemical or what they call it? It's like to do with feelings and stuff, isn't it?
Yeah, it's the hormone that's released when mothers breastfeed. It's the hormone that people release when you hug, like when you hug your partner, when you hug when you something you love. So your best friend, your partner, your animal, your dog, your cat, like that unconditional love feeling. That's what increases oxytocin. That's what we're missing a lot of as a human race right now with all the lockdowns, because we can't actually hug or see our loved ones for a lot of people. And so we're missing out on oxytocin. And so it makes us just feel good. And more importantly, it reduces stress. So when we increase our oxytocin, our stress response comes down almost instantly. And that's so important. That's so much what we need right now.
Right.
And like animals, I have people that are like, well, I don't have a partner and I don't have kids. They're like, but I love my dog. I'm like, dogs do it. Like, like dogs give that unconditional love. So pet your dog and love your dog or your cat or whatever it is. And it's when you get that like unconditional, like, oh, you're the cutest. That's oxytocin.
Is there a maximum amount, or is there you'll get more oxytocin from one than another? Let's say, for instance, lovemaking. Like, is it like a massive influx, or it's like there's a certain quota of oxytocin that you're going to get from all kind of things?
Right. It depends. And people will, you can feel it, right? You can feel it. So you can have lovemaking where you're like, where you feel loved, where you're just like happy, like, oh, that was really good. I feel that. And then you can have other times of lovemaking where you're just, you're just way up in the clouds. Like it was just amazing. You're just so happy, you just feel so loved and so close to the person you were with. So it can definitely be variable. There's not really like a cap on the sensation, or the feeling. And just like people will say, like, when I hug my partner, my husband, my wife, my whatever, like I love them and I love the feeling I get. But when I'm snuggling my baby, like it's amazing how I feel. I'm so calm. I'm so happy. I just feel. And so it can definitely just vary by the interaction, the person, your state of mind at that moment. If you're super stressed out, but hugging your favorite person, like it'll help, but it may be different as if you were really relaxed and in the moment and then hugged your favorite person. So every little bit helps, but yeah, it can be various levels. And the same person or dog or cat or kid may not release the same amount every time. You know, it depends on your state as well.
Yeah. Right. Cool.
Yeah.
So
Yeah.
that's interesting. Very interesting.
Yes.
Oh.
Well, this is good, right? We covered a lot.
Yeah. Yeah.
Yes.
I think you mentioned earlier about adrenals. Could you tell me a bit more about the adrenal glands and its purpose and what it does?
Yeah, absolutely, for sure. And I hate to say that I have to wrap up soon because I have another appointment right after this.
No worries. No worries.
I
We'll wrap up.
apologize.
It's all
But
good.
so the adrenals are 2 glands and they sit on top of your kidneys and they're part of an axis called the HPA. H is hypothalamic, which is in your brain. P is pituitary, also in your brain, and then adrenal, so down on top of your kidneys. And what your adrenals produce are cortisol, which we've talked about, DHEA, plus some other hormones. There's a hormone called aldosterone. Aldosterone helps you deal with your salt-water balance. But the 2 hormones that get the most play or most talk about are cortisol and DHEA. So they help manage stress, they manage your immune system, they help manage glucose, they manage all sorts of stuff. And so and they play into your thyroid. They're best friends with your thyroid, and they play into your testosterone production, and they play into a woman's cycle. They can we call them feedback loops. And so if you're really stressed out, then the body might go, ooh, now is not the right time to make hormones at a normal level. Like, we're going to shut everything down. We're going to bring it down for survival. And then once you move out of the stressful situation, things come back up. The feedback loop relaxes. And so women will say, gosh, I was under so much stress and I skipped a period, or my PMS was horrible, or I don't think I ovulated, or I can't get pregnant. What's going on? I'm like, the brain is going, hey, it's a lot of stress. Let's not do those things right now. It's the same for men. It's the same for men. Men will go, I have so much stress and I'm struggling with my libido and erection ability. I'm like, the brain is like, nope, now is not the time. We're going to affect this. And then not all men, of course, and not all women, of course, but some are more sensitive than others. And so they'll notice as they work through the stress, as they release the stress, that like everything's fine. Everything's back to normal again because of that feedback loop.
Yeah.
Kind of cool.
It's fascinating stuff. Well, do you have a book or anything which is out that anyone can look at?
I wish. I know. Wow. It's on my to-do list. It's on my to-do list to do a whole thing about hormones because I am on Instagram, which is how we found each other.
Yes. And so just tell me your handle again, please, so I can everyone can know.
At dr.carriejones. So at dr.carriejones. And it's all hormones all the time. That's all I talk about for the most part. And and so that's predominantly where I hang out. In the book, hopefully, crossing fingers, is coming. It's on my to-do list.
I need that book. I need that book. And what is your website? Yes. You have a website, right?
I too. So you can actually go to dutchtest.com. You can learn. We have all about hormone testing, which may interest a lot of people, but we also have all webinars, all our podcasts, everything we do is up there, and it's all free. You don't have to be a practitioner. You can hit just play and learn your heart out. And then my own website is drcarriejones.com. So which is primarily linked to Dutch as well. So
that's fabulous. Yeah. That's fabulous. I'm going to put that in the show notes. Thank you so much for your time. Oh my God. It's been incredible. It's been incredible. I'm probably going to DM you some more questions, I swear. Like this is amazing.
Please.
Please.
And I think you should have, I'll hook you up with one of my really good friends. He's who I go to for men's health. I don't know if you have a men's health expert, but I'll hook you up with him. Maybe he's good for your show, so you can ask him all the men's health hormones on testosterone and stuff. Absolutely.
Basically 86% of my followers, actually 87% of my followers are men.
Okay.
So,
all right. Yeah, this will be a good one. Yeah. He's who I go to when I have men's health questions.
All right.
Yeah.
Super.
Fantastic.
Dr. Carrie Jones, thank you so much for your time. I really appreciate it. It was incredible.
Thanks for having me on. I really appreciate it. Yeah.
All good.
Have a great day.
And you too. God bless you. Take care.